To best optimize thyroid function, it's important to look at your adrenals and how well they respond to stress. The best way to assess cortisol, in my opinion, is doing if you can see that, a salivary test through ZRT, doing the 4-point test. It looks at your cortisol level in the morning, before lunch, before dinner, and at bedtime. Today I want to discuss with you 3 consequences of having elevated cortisol as it relates to thyroid function. Number 1, if you have an elevated cortisol level, that can suppress your TSH. As a provider, we can look at a patient's TSH, and if it's, say, below 1 or 0.5, we might be thinking that you are getting too much T4 medication or Synthroid and ultimately lowering your dose, when in fact it's really your cortisol that's elevated that's causing your TSH suppression. Problem number 2, having an elevated cortisol level can inhibit the enzyme that converts T4 into T3. So again, we can look at somebody's T3 level. It could show that it's low. They might need, again, more Cytomel or T3, when in fact what we need to do is lower the patient's stress or lower their cortisol so that that enzyme gets reactivated again. Problem number 3, and probably the hardest to identify, is when our cortisol is elevated, that can suppress T3 receptor function. What do I mean by this? So you might have an optimal TSH, you have an optimal T4 and T3 level, but you still feel tired, fatigued, and have all the classic signs of low thyroid function, when in fact that T3 that's getting inside the cell, the receptor is there but not able to respond and perform basically metabolic function in the body. In the end, I encourage all patients to look at their cortisol levels. Doing a 4-point cortisol test, again this is through ZRT. It's a salivary test. You do it at home, you spit in a tube, send it out, and within 2 weeks we can know how well your adrenal glands are doing and if those cortisol levels are negatively impacting your thyroid function. In order for that to work, you've got to get the T3 inside the cell. So it must be absorbed in the cell, so the T3's got to actually get through this carrier protein. Must be transported to the nucleus. So yeah, once it gets inside the cell, there could be, see, these are all little areas that can go wrong. Your labs could be fine because it's just measuring what's in your blood. There's no test to measure these steps here. So I'm just pointing that out because something could be wrong there. You got to have proper binding. Maybe you've got a genetic SNP that binding protein for T3 is slightly disformed and it doesn't hold as tight as it should to the T3. Must have receptors in sufficient quantities. If you get too much progesterone or fill in the blank, another hormone, cortisol, this receptor right here that draws T3 into the cell, that might downregulate that production. You can see these proteins withdraw back into the cell, and then you don't have anything to transport T3 across the cell. So we got to start looking at some of those things too, potentially. So I hope you found value in today's video. If you did, please share this with a loved one. On Wednesday of this week, April 13th, we'll be hosting another educational seminar here at the pharmacy on vitamin D. Registration is required. Registration fee is $10. You can pay that in advance, call the pharmacy and reserve your seat, or you can do that at the door. Or as always, we are now live streaming all of our seminars, and at 6:30 tune in to YouTube and we will live stream the vitamin D seminar. Have a great night.